Good afternoon, everyone, and welcome to the second statewide IBHS webinar. This afternoon's webinar will be recorded and posted on our website for later viewing. A link to the IBHS website will be provided during the training. We will also reference several documents in this training that have been added to the website. An example of this is the department-approved training process. Because of the number of participants on today's webinar, as well as the department's desire to utilize this webinar for future training purposes, we will not be responding to questions during the training, nor will participants have the ability to speak. We will have the chat function open, so you may type your questions and comments for staff to review after the webinar. We will use your comments and questions to plan future training opportunities, as well as to update our frequently asked questions document. The FAQs are posted on the website and considered to be a living document that will continue to evolve as we progress in IBHS implementation. Today's webinar will provide a summary of the topics discussed during the regional forums, as well as providing new information regarding the implementation of IBHS. We will present information regarding the regulations, licensing, enrollment, and billing. We'll look forward to your feedback on these areas, as well as suggestions for future training. At this point, we'd like to transition into the main portion of the training by introducing each of the speakers and their areas of responsibility as it relates to IBHS. My name is Courtney Malecki, and I work in the Office of Mental Health and Substance Abuse Services, or OMSAS, in their Children's Bureau. I direct policy planning and program development for children's behavioral health services in Pennsylvania and have primary responsibility for the regulatory aspects of the IBHS regulations, as well as assisting in the overall implementation of IBHS.
Hello, my name is Angela Douglas. I work in the Harrisburg Field Office of OMSAS, and I'm the statewide licensing coordinator.
Hello, I'm Amy Cabirio. I'm a clinical consultant for the Office of Mental Health and Substance Abuse Services Children's Bureau.
Hello, Kimberly Bush. I'm Medicaid Finance within OMSAS.
I am Charles Klinger. I'm the Systems Division Director for OMSAS.
My name is Summer-Ann Clark, and I work in the Systems Division Provider Enrollment.
Great. Thank you, everyone. So we'll get started with the presentation now by just going over some basics regarding some key touchstones for IBHS implementation. So the IBHS regulations were published on October 19th of this year, and they have a 90-day effective date, which means that providers are required to comply with the IBHS regulations by January 17th of 2020. So we recognize that we have some staggered implementation timeframes for this, and so as you go through the regulations, you'll see that different base license types from BHRS or different kind of enrollment types in BHRS have different requirements for licensure in IBHS, and those deadlines will happen throughout 2020. And then every IBHS agency will have to be licensed by January 17th of 2021. So this means that we'll really have a year-long transition process where children will be kind of moving out of their BHRS authorizations and into their IBHS authorizations as providers are becoming licensed as IBHS. So everyone in the department is prepared to work with the providers and our stakeholders during this year-long transition period, and we'll certainly be having more conversations about that. But at the end of 2020, so we'll really be finishing up BHRS and talking with managed care organizations and the department. We've all agreed that we will be able to complete this transition within a year, and that no BHRS may be provided after January 17th of 2021. So as we go through this transition, I just wanted to thank the managed care organizations and our primary contractors for their ongoing collaboration. This really started before the regulations were even promulgated so that we could really have this transition and implementation process go as smoothly as possible. So I commend them for really stepping up to the plate early and helping us talk through a lot of the implementation questions, because the regulations were written very quickly and it was really important to have the conversations to think through the implementation. And it was those conversations that were really the impetus for having the regional forums and making sure that other stakeholders besides managed care organizations and primary contractors had an opportunity to have conversations. So in addition to the regional forums, we've also done some internal training within the Department of Human Services, because we know IBHS will touch on Office of Children, Youth, and Families, the Office of Medical Assistance Programs, and really our other sister offices within DHS. So we've made sure that we really are collaborating internally and externally in the implementation of IBHS. So as we started the regional forums, we had 7 forums that took place across Pennsylvania throughout October and into November. And this really was an opportunity for folks to come and meet OMSA staff, have a conversation about their questions, and really talk through some of the details that people had questions about reading the regulations for the first time. So our first forum actually was the day that the regulations were promulgated, I believe.
The day that we found out the regulations were going to be promulgated.
Thank you. The day that we found out that the regulations were going to be promulgated. So it's been quite the journey, and kind of going across the state while we've been in these different areas, and people have been kind of watching the regulations develop as we've been out and the implementation. And I think one of the important things that we've been saying throughout the forum is that we will work with folks throughout this transition year, and we understand that it's a process. So I think that each of the different areas will go into kind of whether it's licensing or enrollment, kind of how they're prepared to work with you, but that we're all operating under the understanding that you're not able to act on information that you don't have. And so we've been coordinating with everyone just to make sure there's an understanding, and there's no kind of anxiety about what comes next, because you're not going to be able to act on information that you don't have. So if you don't see medical necessity guidelines, you're not going to be able to use medical necessity guidelines until you have them. The MCOs have really been proactive in kind of addressing certain processes that are in place now, such as ISPTs, and saying if you have ISPT meetings scheduled, we understand that they're not part of the requirement for the regulations, but go ahead and keep those during this transition period, because that's a really good place to talk to folks about the changes, as well as make sure that services are continuing to be provided. So we really want to make sure that throughout this entire process that children continue to receive the services that are medically necessary as well. So I think now we'll go into some of the key areas that we discussed during the forum. So the first area that we had a lot of conversation about in the forums is the written order. A written order is new. It's not something that those that have been providing VHRS are really accustomed to seeing. So we spent a lot of time talking about the differences between a written order and evaluations. And one of the things that I think is important to understand is that a psychological or psychiatric evaluation can meet the requirements of an order. You just need to go to the regulations and make sure all the required information is in the evaluation, and then it could count as a written order. So one of the changes that happened when we wrote the regulations for written order is that it really expanded who could prescribe IBHS. So based on Act 76, we have new authority to allow additional licensed individuals to diagnose and prescribe for services. So we went ahead following Act 76 and wrote that language into the IBHS regulations. So as of right now, licensed clinical social workers, licensed marriage and family therapists, licensed professional counselors, and certified registered nurse practitioners are all able to write an order in addition to physicians and psychologists. So we have an expanded amount of licensed practitioners that are able to write the order. And because of this, we've had questions come up in the regional forums regarding the order referring and prescribing or ORP requirements. And so ORP does apply to IBHS, and our enrollment folks will go into some details about what they've done to accommodate the new licensed individuals. But just so everyone knows, there have been changes in the system made so that anyone that is able to write an order will be able to comply with ORP. The next thing to talk about in a written order is the language regarding in the regulations that a written order is for a number of hours up to a maximum amount and what that might mean. So if a written order comes in and it says 30 hours of BHT are needed, the way that will be read based on the regulations is that up to 30 hours will be needed, and that an assessment will be used to help determine the exact number of hours within those 30 hours. So when we're looking at written orders, it's really looking at an up to or a maximum amount, knowing that we have a secondary process, which is the assessment process, that will be able to fine tune those hours based on the assessments they're doing in the home and community environments, which are typically not available for traditional evaluations, which are most often done in an office setting. So based on this, we will continue to utilize psychological evaluations and psychiatric evaluations when they're clinically indicated. And at this point, there's nothing changing regarding the medical assistance bulletin that talks about the different evaluations that are available to be provided. We've been having discussion about expanding that bulletin to include the other licensed professionals, but that's still under discussion. And we're also doing outreach to qualified prescribers, knowing that we really have new professional entities to reach out to and to really help educate them about IBHS and written orders. So that's something that is a focus and a concentration moving forward for us. So if there's any groups or entities that you believe we should really be reaching out to in terms of educating people that can write the written order, those licensed professionals, please go ahead and type that into the chat box, or go ahead and email our RA account for IBHS, because we really are looking forward to the next step of going out and speaking to new stakeholder groups regarding IBHS. The next thing that we talked about in the regional forums, which pairs nicely with the written order, is the assessment. So there's a couple of things regarding an assessment, and I guess one more thing I should say that ties back to the written order and psychological evaluations is that oftentimes psychologists and psychiatrists, as part of their evaluation, will conduct assessments. And we recognize that, and that doesn't need to stop or change We're not doing anything to intrude on professional scope of practice. What we're doing is requiring that whatever form that written order is in and whatever information that's included in it, including any assessments that might be done by a psychologist or psychiatrist or another eligible licensed professional, that information is reviewed by an entity that will be providing IBHS services, and they're going to conduct a home and community-based assessment. So based on the information in an evaluation or a written order and how thorough it is, may determine how much additional information is needed in the required IBHS assessment. So if there was a lot of assessment and clinical work done as part of the written order, they may just be verifying information in the home and community-based settings, and it may be rather brief. They may also really have identified an assessment that needs to be done in the home and community that was not done in the written order. So what we've been saying in the regional forums is we really hope that through the IBHS process to give a lot of kind of the information that's needed and those decision-making qualities to the treatment team, because they're the ones that are going to be interacting directly with the children and family and having those ongoing discussions. So just to jump ahead a little bit, I'm not sure if this is actually a bullet going forward or not, but that was one of the reasons why we didn't require ISPT meetings in the regulations. We really want people to continue to have treatment team meetings, but we want them to happen when they're clinically indicated and when they make most sense for that individual child and family. So we have expectations about those meetings continuing, but we didn't want to, in a regulatory sense, make an arbitrary requirement for everyone based on a certain time frame, especially since we've gotten feedback back from folks that for ISPTs, it was sometimes a barrier to accessing services. So in the regulations, we really wanted to concentrate on the things that we do not believe would need to change at all in the provision of the service, and know that there will be additional details in policy and operation manuals in regard to how the details of the services are provided. So back to assessment. The written order and assessment are both required in order to receive IBHS. So you must conduct both pieces, and in order to proceed with an approval, the written order and the assessment must be consistent. And what that means is that the hours recommended or the services recommended within an assessment have to be consistent and fall within what was ordered and recommended in a written order. So for example, I said earlier that there was a written order recommendation for 30 hours of BHT. If the assessment was conducted and they found 20 hours of BHT was needed, that would be considered a consistent written order assessment combination because the 20 hours falls within the 30 hours. So anything that is within the range, that maximum up to of a written order, will be considered a consistent assessment written order combination. We recognize that there may also be times when an assessment is not consistent with a written order. So in those situations, one has to recognize that you'll not be able to proceed with receiving and providing IBHS services until you have a consistent written order and assessment combination. So if you have a written order that's discrepant with an assessment, there are a number of things that can happen. One option would certainly be to go back to the individual that wrote the written order with the assessment information and have a conversation about the difference in findings. Now, we recognize that it may not always be possible to go back to the individual that originally wrote the order. So a possible example of that is if someone was in the emergency room and the doctor in the emergency room wrote the order for an IBHS service, and that when the assessment was done, it was finding that something different was needed. In that situation, we could certainly go back to someone that was regularly in the child's life or would make sense to have an ongoing relationship with that child and family, write an order based on the assessment information and what they saw in their face-to-face meeting with the child and family. So this is new to everyone, and this is another place where we can anticipate what consistent assessment and written order combinations may look like, and we can anticipate that there are going to be situations where they will be discrepant, but obviously none of us have done this before, so we're not sure what all those circumstances might be. So as those things develop and we get more policies and procedures in place, we'll be able to put out more details, either statewide or through the managed care organizations. And I will say that the managed care organizations across the state have really all been coming together and doing their best to talk about what makes sense to be consistent across the state and having conversations about where they can have the same requirements to really make it easier on providers so that you're following as much as possible the same policies and procedures, the same protocols, regardless of the managed care organization that you're involved in. So obviously that won't always happen, but they really have been conscientious and meeting and trying to talk through that and making sure that wherever it makes sense and they're able to, they follow through with kind of one standard process. So the qualifications to conduct an assessment, the individual conducting the assessment will need to meet the requirements of either a mobile therapist or a behavior consultant, and that's a behavior consultant either that falls under the individual services or the ABA services. And we've also gotten some questions about if a functional behavior assessment or an FBA is considered an assessment and if it would meet the requirements for an IBHS assessment. And the answer to that question is yes, it would meet the requirements. All right, so if we can go on to the next slide. We talked about the ISPT, so that bullet was in there. And again, so it is not required in IBHS that you have an ISPT, but we do expect that treatment team meetings continue to occur. And we think a likely spot for the treatment team meetings to occur would just initially, to start off at least, would be after the written order and the assessment were conducted, that a treatment team convened in order to discuss those findings and recommendations, and then develop, the ITP, or the individual treatment plan. We wanted to also put a bullet up about CRR host homes. We've had some questions. There are not a lot of providers across the state for CRR host home, but we recognize that they will roll into IBHS, and we've tentatively been saying that they will fall under individual services. That could also fall under ABA services, depending on how the services within the host home are delivered. But because it's a little bit of a special circumstance, we've talked to a number of CRR host home providers and have committed to having a special meeting with the host home providers just to talk through some of those situations and what makes most sense in terms of implementation. So we'll put out notification on the website and hope to have that meeting with the host home providers in the very near future. Another thing that we've been getting questions on is where does my program exception from BHRS fall? And so program exceptions under BHRS are really a pretty broad and varied category. They include the summer therapeutic activity programs, they include school-based programs, and they really include some unique provider-devised programming as well, some social skills programs, after-school programs. So there's really a lot of different things in this category, but for the most part, the program exceptions require children to come to a specific place to receive the services and programming. So if that's the case, then the program exception will fall under the group services bucket in IBHS. Because within IBHS, the only time that you can go to a specific place to receive treatment or programming in terms of not individual services will continue to be provided wherever the children and family need them, but this is really a group programming at a specific site. That's referred to as community-like setting within IBHS. And so anytime you have a center-based or a site-based program, that's going to fall under the group services because that's considered a community-like setting within IBHS. So we certainly can take any questions about specific program exceptions, either through the chat function now or through our IBHS email account. But overall, we expect that most program exceptions will fall under group services. And then for evidence-based therapy, on our website, we have a list of department-approved evidence-based therapy. And those programs we have are MST for multisystemic therapy, which has a number of different iterations that are approved through our website. We also have functional family therapy and parent-child interaction therapy. And just a note about parent-child interaction therapy, that's currently available through our outpatient clinics in OMSOS, and that will continue to be available. So anyone that is currently providing PCIT through outpatient, you don't need to change anything. You don't need to get an IBHS license to provide it. You can continue to provide PCIT through outpatient clinic. We just really want to support the program, and we know not everyone that wants to provide PCIT is able to get an outpatient license. So we're going ahead and offering it in addition to an outpatient clinic through IBHS. You'll have to get an IBHS license and meet all the physical site requirements of PCIT in order to provide it, but we're able to license PCIT both under outpatient and IBHS. And I know that the PCIT developers are also working with some folks in Pennsylvania on an intensive family coaching program. And so even though that's with the PCIT developers, that specific program is not evidence-based at this moment in time. So you'll be able to continue to provide that service, but it'll fall under an individual service rather than an EBT. And then for service descriptions, the service descriptions that providers have been providing through BHRS really serve a different function. We didn't have regulations or licensure for BHRS, so really the service description process was one of our only mechanisms to be able to understand the service and what was being provided. And there was really a different level of scrutiny on the service description based on that being the primary method that we had available to us to be able to have a provider describe the service and be able to monitor and have some oversight of the service. Now that we have IBHS and it's licensed and has regulations, the requirements of the service description, which are set forth in the regulations, are a little bit different, and the way that you can expect to work with the field office regarding the review of the service description are certainly different because there's just not going to be as much detail. You're able to put every service that you provide under IBHS in one service description. So I know if people have questions about that that are outstanding, we have the October 4th webinar that we really went into a good amount of detail about what was required as part of licensing. I don't know, I'm looking at some licensing staff. Are we going to talk about that at all today, or is that really something that they should refer to the October 4th webinar for?
We're going to talk about service descriptions a little bit again today.
Okay, great. So we have that coming in a few minutes. And then we also wanted to just make a note in BHRS, we had individuals that became providers of BHRS based on their individual practice license. So whether that was licensed psychologists or licensed behavior specialists, we allowed folks to come in to provide BHRS based on that individual license. And because it was their individual license rather than an agency license, there were different requirements for individuals versus agencies. And agencies were allowed to do things that individuals were not in terms of a provision of service. So an individual license wasn't able to provide a program exception, for example. So with IBHS, again, we're really evening the playing field. Everyone will have the same license. Everyone follows the same regulations. So there's no different standards or direction for individuals because everyone will have an agency license. And I know there was some concern and questions, particularly from psychologists that had their individual license expiring in mid-November, wondering if they had to receive an IBHS license prior to their individual psychology license expiring. And the answer to that question is no. There's a certain provision within the regulations that allows psychologists that have approved service descriptions for BHRS up to 1 year to receive their IBHS license. So that doesn't mean you have to take the whole year, but you're able to do so. And again, that's something that licensing may get into a little bit. Okay, so I think at this point, we're going to move on to the department approved training process.
Sure. So next we're going to talk about the department approval process. We have added 2 documents that are on the IBHS website that pertain to this. One of those documents is titled The Process for Department Approval of Trainings Required by the IBHS Regulations. And I believe that we're going to pull that up right now. So this document really outlines, what our process is for approving training. So prior to submitting anything for approval, I would encourage you to read through this form and take a look at the IBHS trainings that would not require department review and approval. So we have several of these items listed. For example, trainings that are offered by the state. So this may be trainings offered by the Office of Developmental Programs. So folks I know had previously, taken many trainings that had been offered by the Bureau of Autism Services. Those would all fall under there. Trainings offered through the Office of Child Development and Early Learning, the Pennsylvania Key, as well as Pennsylvania Training and Technical Assistance Network. So those trainings, if you have a training that you would like to use for IBHS purposes, you do not need to submit any documentation requesting approval to use that. Additionally, trainings that are offered by the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Service Administration, we would not need to review those. Trainings that are offered by a Behavior Analyst Certification Board authorized continuing education provider, those do not need to be reviewed. On the form, we have included a link for where you can find providers of those trainings. Trainings that have been approved for continuing education credits for professional licensure or certification. So for example, if a training says that it is available for social work credits, that's not something that would need approved. Those offered through Relias, we will accept those as well. And then the next section that we have pertains to trainings on the Child Protective Service Law and mandated reporting. So we are only able to accept trainings that are identified on this list right here. So several are offered through the Pennsylvania Family Support Alliance, the Pennsylvania chapter of the American Academy of Pediatrics, the University of Pittsburgh's Child Welfare Resource Center, as well as organizations that can be found at the hyperlink that I have listed. So if you open that link, it will give you a large list of organizations that offer trainings that have been approved on the Child Protective Service Law. Additionally, we would not need to review trainings that are on first aid universal precautions and safety that would be provided by the American Heart Association, American Red Cross, National Safety Council, American Safety and Health Institute, Medic First Aid, Emergency Care, and Safety Institute. So your first step is really to look at, does the training that you're wishing to provide meet the criteria that we've just described? If it does, then you do not need to submit anything for further approval. However, if you do have a training that you would like to submit for review, you can do so by sending your training as well as a request for IBHS training approval form to the email address that's listed on the form that you can currently see. This is our resource account that we have dedicated to questions as well as where you can submit any training. So when your training is submitted and sent to us, this is the form that will come through. So when we receive that form, a Children's Bureau staff member, they will review the training approval form that's been submitted. That also requires you to submit any of your training materials that you would be using. And so we'll conduct a review of the training. And once that process is complete, the Children's Bureau will notify the training organization of its decision. So we will get in contact with you and let you know if this does meet the requirements for department approval. If it is approved, it will be assigned an IBHS training record number. And so that number, it's going to be a 6-digit number. The first 3 digits will be specific to either the IBHS agency or the organization providing the training. And then the second 3 digits are going to be the course number. If the training is not approved as submitted, a decision will be, we will contact the provider or the organization regarding that decision, and then we will try to work with the provider or organization to take the steps necessary to get it into a place where we are able to approve the training. So again, this is just the form that you would submit. I believe it's pretty self-explanatory regarding the information that you need to include. So, just some basic organizational information about the type of training that you're providing, what the objectives are there going to be tests, quizzes, what your outcome measures will be. And then the next page of that form goes on to have you check off any of the corresponding training categories, that the training aligns with that you're submitting. So it may just be one category. Perhaps it's a longer training that covers multiple areas. You would check any of those that apply. And then if you scroll down to the bottom of the page, it does have you identify instructors or authors. I understand that, we have 4 slots listed there. There may be many trainers at your organization. So if you want to just list 1 or 2 primary contacts as well as their credentials that would be really taking the lead on the training, that is fine to do as well. And then, what the training format will be, just identifying what that will look like, as well as including any of the training materials that will be used. So that kind of outlines the general training process. If an organization would update or make revisions to a department-approved training, it does need to be reviewed by the Children's Bureau before it can be used. So you would just email an updated copy of the training materials to that email address that we had listed. And then after we review those, we'll follow up with you regarding any other actions that may be needed or if the training is okay to continue to move forward with. And again, those documents are all found on the IBHS website.
Okay, so medical necessity guidelines, they are still under development, and I'm sure many of you can relate. This is an unenviable challenge to write medical necessity guidelines for IBHS, and part of the issue is that the services through IBHS are rather broad and serve a great variety of needs and individuals. So trying to encapsulate all that into a medical necessity guideline for something like individual services is very broad and challenging and still have it be useful and meaningful. So it's something that we continue to work on, and we really hope that we'll have it out shortly. But we know that this falls under the category of you can't act on something that information that you don't have. So we recognize that we need to get medical necessity guidelines out to the public in the very near future, and we have been working within the department as well as with our partners through the primary contractors and managed care organizations in order to really have something that's meaningful and useful for folks to guide the medical necessity of IBHS. So at this point in time, we're really looking at medical necessity guidelines for individual services, group services, ABA, and then EBTs as they're delivered through individual ABA or group services. We're also having some open discussion regarding whether or not it makes sense to have separate medical necessity guidelines for CR or host home, because again, they're a little bit different than the typical home and community-based services, even though they fall within that umbrella. So not much of an update for this right now, other than to say it's something that really continues to be a priority for the department, and we really hope to have those medical necessity guidelines released in the very near future. For the family outreach and education, we continue to have this on, as a priority for OMSAS and the department. We really want to make sure that the department, as well as the managed care organizations and the providers, continue to work with the families, that they're preparing them for a transition to IBHS, and really that we're available for questions and have good communication strategies and guidance for families. So as a first step, we've developed a family fact sheet, and we'll pull that up now. And this is based on questions that we've been getting from family members, and it's something that we've reviewed with family members in terms of language and just making sure we're hitting some of the right questions. So we're not going to go into all the questions and answers now, because you can read that on your own time. But really, this is the first step to get out initial information and make sure that everyone has a singular starting base when they're educating families, and really have a state document that they can reference. We're certainly open to feedback about the fact sheet, as well as additional outreach and things that you would like us to do in terms of educating families and talking about the transition from BHRS to IBHS. So if there are specific questions that you want answered in regard to family members, if there's specific outreach or training you think we should have geared toward family members, please feel free to contact us through the chat function on this webinar or through our IBHS email account to give us additional thoughts on family outreach and what would be helpful or needed in that area. Now we're going to flip over to give you a screenshot of the Health Choices website that we've been referencing.
Sure, and this screenshot here, this is the website that we've been discussing. You'll find on here that there's a lot of resources, so we really encourage you to check back on a regular basis. We are constantly updating the website as new documents or resources become available. And along those lines then, we do have some new resources that we just wanted to make sure to highlight that folks are aware of. So we have had some updated versions of the frequently asked questions that you can find on the website. We do have the documents that we just went over regarding the IBHS Department Approval of Training, as well as the form that you submit for approval of the training. The family fact sheet can be found there, IBHS draft code. There is a link for the Human Service Provider Directory, and you can now also find copies of the PowerPoints from the webinar that took place on 10/4, as well as today's presentation. We also did want to highlight two of our resource accounts. So the first one is the IBHS resource account. And so if you have questions, areas that you think may be helpful for us to follow up on for future training or in the frequently asked questions, I would encourage you to send those directly to that account. The second resource account is pertaining to training. So if you have trainings that you would like to submit for department approval, please feel free to reach out to that email address and send those there. Yep. So next we're going to talk a little bit about licensing.
Hi, this is Angela. Now we're going to provide some licensing updates and touch on the first phase of licensing IBHS agencies. Statewide, over 350 agencies have been identified as needing an IBHS license. An IBHS agency is defined in Chapter 5240 as an entity that provides one or more IBHS. IBHS includes individual, group, applied behavioral analysis, and evidence-based therapy programs. IBHS agencies will be licensed in 4 different phases as outlined in Section 5240.3, Provider Eligibility. OMSAS has engaged in outreach efforts with the first phase of licensing, which includes IBHS agencies that meet the requirements included in Section 5240.3A will need to be licensed by January 17, 2020. This includes existing IBHS agencies that are not enrolled in the Medical Assistance Program. Just a reminder that licensing and enrollment are separate processes. It is an agency's choice whether it enrolls in the MA program for payment purposes. The regional field offices have begun to receive IBHS service descriptions. If your agency is identified in the first phase of licensing, service descriptions should be submitted no later than December 18, 2019 to ensure adequate time for review. They are being reviewed and approved using the service description checklist document. As a reminder, the checklist can be found on the IBHS website. If an IBHS agency serves more than one region, a service description should be submitted to each applicable field office. Each agency should identify which type of IBHS they are providing and in which counties. For example, if an agency provides individual, group, and ABA, their service description should have a heading in each of those areas with a description of the services that fall underneath that service type and which counties they serve. We just wanted to remind agencies that they are not required to have a county letter of support to submit a service description, but are required to request one as part of the licensing application. We have begun to receive IBHS application packets from Licensing Administration. Just as a review of the licensing application instructions, contact the County Mental Health and Intellectual Disability Office to alert them of the licensing application and request a county letter of support. Contact applicable behavioral health managed care organizations to discuss the credentialing process if you are not already familiar with it and if you plan to serve MA. Compile all documents in the checklist in the licensing application instructions document to submit to Licensing Administration. Licensing Administration will review to ensure the submission is complete. A field office representative will reach out to schedule the initial visit after Licensing Administration reviews the application packet. Contacts for the county administrators and the MCOs, as well as the licensing application instructions document, are posted on the IBHS website. Site visits have started to occur for agencies in the first phase of licensing, agencies that have a base mental health license that expires in January or February, and agencies that have reached out to initiate the licensing process sooner than required. If you are in the first phase of licensing, the field office should have already been in contact with you. If you believe you are in the first phase of licensing but no one has contacted you, please reach out to the applicable regional field office and review the outreach letter posted on the IBHS website. On this slide, you will see the regional field office contacts for the Central Field Office and the Northeast Field Office. On the last licensing slide, you will see the regional field office contacts for the Southeast Field Office and the Western Field Office. And just a reminder, there is a contact sheet that is posted on the website that has all this information, and it has also been attached to the webinar today. So now I will turn it over to Chuck Klinger to discuss enrollment and billing.
Okay, this is Charles Klinger to talk about enrollment and billing. IBHS agencies may enroll for the following 3 provider type specialty code combinations. Individual IBHS under provider type 11, provider specialty 590. Group IBHS, provider type 11, provider specialty 591. Applied behavior analysis, provider type 11, provider specialty 592. These provider type specialty code combinations are currently active in Promise. Draft procedure codes and corresponding provider type specialty combinations are on the IBHS website. Some pricing modifiers may be changed when rates are finalized. I just want to note that if you do go to the document on the website, not all columns is for both fee-for-service and health choices, so not all columns may apply to you as a provider. The next slide I have to discuss today is the ordering, referring, prescribing, or enrollment. As Courtney mentioned earlier, there's 7 professionals who can order, refer, or prescribe IBHS. This includes a psychiatrist, a psychologist, licensed clinical social workers, physician assistants, and certified registered nurse practitioners. And they all have existing provider type specialties for which they can enroll. For IBHS, we've added 2 additionals. The licensed professional counselor, provider type 11, 594, and the licensed marriage family therapist, provider type 11, provider specialty 593. As with other MA services, practitioners that order, refer, or prescribe IBHS for MA beneficiaries may be enrolled in the MA program for the IBHS agency to receive MA payment for IBHS. As of October 2019, licensed professional counselors and licensed marriage and family therapists are able to enroll as ordering, referring, and prescribing practitioners. The next slide is a brief discussion on the provider enrollment. Electronic provider enrollment applications can be accessed from the secure internet site with the URL that's on the PowerPoint. Utilizing the electronic provider enrollment portal is preferred method for submitting IBHS agency enrollment. In the event that you are not enrolling using the electronic provider enrollment portal, please send your applications by paper or scan an email directly to OMSOS at the information below. Just want to make a note that portal application processes will remain the same. IBHS agency applications submitted through the portal will be routed directly to OMSOS for expedited completion. The change for agencies will be specific to the paper application. This will be a temporary process to ensure timely completion in enrolling IBHS agencies, and the future applications will be processed by Office of Medical Assistance Programs. IBHS agencies will be notified when enrollment processes change. We also have some 3 systems-related questions to cover. The first one being, if an agency is not licensed to provide IBHS as of January 17, 2020, can the agency still bill using the new IBHS codes, or will it have to bill the old BHRS codes? As of January 17, 2020, agencies may bill for either BHRS or IBHS. OMSOS will monitor to ensure that agencies are not billing for BHRS and IBHS for the same service. Second question, can an agency submit claims for IBHS if the agency is not yet licensed? OMSOS is working with our data systems partners to develop a process for an agency that's not yet licensed as an IBHS agency to be able to submit claims using corresponding IBHS procedure codes for the BHRS providers. Will there be a cutoff date or a soft transition for BHRS claims? Claims for BHRS cannot be submitted with a service date that is after January 17, 2021. Okay, I will now pass it along without further ado to our colleague, Kim.
All right, hi, this is Kim from Division of Medicaid Finance. A quick update on the rates. We are currently reviewing the Medical Assistance Program fee-for-service rates. When the review is completed, the rates will be published in the Pennsylvania Bulletin. Now I'm going to send it back to Courtney for some closing remarks here.
Okay, everyone. So that's the information that we have to present to you today. I just want to close by really thanking everyone for taking the time not only to join in and listen to the webinar today, but really coming out to all the forums. It was immensely helpful to really hear some of the questions, have conversation, and it's really helping with the implementation. It was also very nice to be able to meet so many of you and be able to put faces to the names that we often see over email. So as you have questions, continue to contact us through our IBHS email account that's on the screen, and we will continue to update information on the website and continue to provide forums, whether it's through webinars or regional trainings or some other mechanism, as we continue to put more information out to ensure that we're able to have conversations and dialogue and continue to give you the information that you need for IBHS. So thank you very much for joining us this afternoon, and have a wonderful rest of your day.